Hello, everyone, and good afternoon. Thank you for joining today's session about career options for public health disciplines. We are aware that several Mexican students are eager to study the United States and most likely studies or programs regarding public health sciences and all that. So this is a great opportunity for you to get to know what's a career within these kind of programs. Okay. My name is Jorge Reyes. I am one of the Education USA advisors in Mexico. I cover the peninsula part. I cover the states of Yucatan, Campeche, and Quintana Roo, and also Oaxaca, Guerrero, and Veracruz. And with me is my peer, Christy. Christy, she will be delivering the first part of the presentation. And we also have two guests today, two other hosts that will be conducting the whole presentation. So in case you are watching this from Facebook, feel free to also share your questions. We will be discussing this at the end of the presentation with Jessica and with Carlos. So yeah, thank you very much for joining. And Christy.
Thank you, Jorge. Welcome, everyone. So, as Jorge said, this session is about career options for public health disciplines. I am Cristina Vizcarra. I'm the Education USA advisor for Jalisco, Aguascalientes, and Guanajuato. And my advising center is at the Esquina Franklin, inside the Public State Library of the University of Guadalajara. Okay. Can we go to the next slide, please? Thank you. So, well, I'd like to start by explaining what Education USA is. In case you don't know, we are a global network of advising centers of the U.S. Department of State, and we are your official source of U.S. higher education. There are advising centers all over the world, but here in Mexico, we have 23 advising centers. We work together with the U.S. Embassy and the consulates in the country, and our mission is to provide accurate, comprehensive, and current information. Our objective is to guide you through the application process, inform you about the general requirements, and facilitate the research of options to study in the U.S. That's what Education USA does. Next slide, please. And well, then we also have different services, and it's important to mention that all of our services are free. So we have in-center services. We offer information sessions, one-on-one advising sessions, workshops, and we also have official resources and study guides in the physical centers. We also do outreach activities. We offer information sessions in local institutions, so we can go to your university or to your high school or different institutions to provide all the information and all the services that we do. We also offer workshops and we participate in mobility fairs. And we also have virtual activities. We offer also information sessions like this one-on-one advising sessions, workshops, webinars, and we also participate in virtual fairs. And as I mentioned before, all of our services are free. Next slide, please. And well, we guide students through the 5 steps to study in the US. Step number 1 is research your options. So you investigate the universities that you want to apply to. The second step is finance your studies. So in this step, you look for scholarships, if you need a student loan, if you have savings, so we help you on that. Then step 3 is complete your applications. So we check the requirements that each university has, and we help you complete all of that. Then the 4th step, once you have received your acceptance letter by the university, the next step is to apply for your student visa. Then the last step is prepare for your departure. So in Education USA, we always have advising centers for advising sessions for students who are ready to start their academic life in the US. We talk about different topics like the cultural shock that they're going to face in the US. So those are the 5 steps that we guide students on. Then next slide, please. So the first thing that you need to ask yourself is why studying in the US? Why do you want to choose to study in the US? Well, because the US has globally recognized schools, and we also help you find the best fit because the best school is not the one that is in the top 5 ranking, but it's the school that best adapts to your needs. Yes, and also we have a multiculturalism, because when you go and study in the US, you are going to be in touch not only with the American culture, but also with culture with cultures from all over the world. And they also offer opportunity for professional development and flexibility in academic programs. Yeah. And finally, they also offer financial support for international students. So that's the first thing that you need to ask yourself. Then next slide, please. And well, so now I'm going to give the word to our guest speaker today. So first, I'd like to introduce her. She's Jessica Sheeran. She serves as the Assistant Dean for Student Affairs at the University of Nebraska Medical Center, College of Public Health. Jessica has been with the college almost 20 years, serving in education administration leadership for her entire tenure. She holds a BS in exercise science, a master's of public administration and health policy, and is a doctoral candidate in medical education and health practice. When she's away from work, Jessica spends much of her time with her horses, and she loves to spend time with her husband and her son in their country acreage. So thank you so much, Jessica, for joining today. And well, we welcome you to this session.
Thank you so much, Ana and Jorge, for inviting us today. And I am also joined today by Carlos Eduardo Martinez Rangel, who is one of our PhD students here in the College of Public Health. And so he'll be with us to help answer some questions at the end if anybody has them.
Hi, nice to meet you.
There he is. All right. So our objectives today are to describe public health and the public health disciplines, discuss careers in public health, discuss the career outlook for public health, describe the University of Nebraska Medical Center, or as you'll hear me reference it as UNMC, and the UNMC College of Public Health, and describe the degrees that we offer in the College of Public Health. So to start off, I like this quote. It to me speaks very intimately about public health. And it is, there comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. And to me, that speaks to the core of public health. And Archbishop Desmond Tutu really hit it on the nose, that to prevent the most health issues, we have to figure out what are the causes and start interrupting the causes of the issues that are affecting our health. So public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Overall, public health is concerned with the protecting of health of entire populations. These populations can be small, as your local neighborhood, or as large as an entire country or region of the world. In public health, I think it's important to keep in mind that the healthcare system, or the doctor-patient, clinician-patient relationship that we see, that really is working on issues of health after they've happened or as they're happening. It is part of the public health system, but public health is larger than just the patient care clinical portion of health. Right. One of our foundational areas in public health are what we call the social determinants of health. And social determinants of health are the conditions in the environments where people are born, where they live, where they work, play, worship, age, that affect a wide range of health and functioning and quality of life outcomes and risks. okay? So when we look at this little wheel here off on the side, the social determinants of health, we look at things like how does access and to quality education improve our health, right? Or how does the lack of access to quality education hurt our health? As you know, individuals are able to attain education, then they are then able to provide more for themselves and for those that rely on them. And they're also able to be a little bit more socially and financially mobile and able to get to resources. Healthcare access and quality. Do people have access to the healthcare that they need? Do they have access to good quality healthcare? Are they getting the treatment, or is the quality of care that they have access to not such that they aren't getting the support that they need to improve their health through that mechanisms? Neighborhood and built environment. Are the neighborhoods that we in are safe? Are they safe for kids to go out and play? Are there areas for people to gather and celebrate and build community? Are the buildings that they're in safe? Are the materials being used in those buildings safe as well for them? And so that we really look also at what are the spaces that we live our daily lives in? Our work environments where we spend a lot of our time. Are we keeping people safe in those environments as well? Social and community context. So do people feel safe? Do they feel like they can discuss the problems in their lives, that they can seek the care and the help and support that they need? And economic stability. Are people able to get to the funds that they need to be able to provide for themselves? Are they able to afford to eat healthy and to live somewhere where the building is safe and get to the care that they need? This here is just a little schematic that I like the way it shows all the different ways in which public health is around us, whether it's in the social work that we do to support individuals and families, preventive healthcare, so healthy eating and not smoking, population health. Are we, how do we look at the health of groups of individuals? Work, occupational safety and health. Are we keeping people safe in their working environments? Economics. Are they able to afford healthcare delivery? Do they have access to good care? Can they find doctors and clinicians and nurses and dentists and that they need? Do we know what's going on in some of the root causes, the epidemiology in public health? And I'll talk a bit more about that later. The environmental health. Are we looking at things like air quality and the quality of the water people have, but also looking at things like the impact of climate change on human health, the community health, and the biostatistics or the data behind our health. Do we understand it? Do we know how to use it in order to make good decisions? Next, I'm going to speak to you a little bit about the public health disciplines. And what are some of the careers and opportunities within them? I'm going to start with biostatistics. What is it? Biostatistics is applying statistical discipline to complex problems presented in all areas of biology and medicine. It summarizes what is being seen and observed in the data. It looks for patterns and trends. So if we look at a data set around heart disease, are there certain populations or that we're seeing that have higher risk factors for heart disease? Are we seeing individuals who have heart disease, are men or women, maybe more adversely affected? Or are there lifestyle patterns that maybe help some, but are not necessarily helping others remain healthy with heart disease? So that's what I mean by looking at the patterns and trends and making inferences or predictions about future situations or the population at large. So taking that data and being able to make some predictions about things like lifespan is one we hear a lot. What's the average lifespan of certain individuals? Or if somebody is a smoker starting in young adulthood, what are their chances or their likelihood of developing lung cancer and things like that. Example careers, data or statistical analysis, a health science researcher. We have a lot of them here at UNMC. There's very little research that happens at UNMC without a biostatistician as part of the research team. They're there from the beginning to help design the research. Applied statisticians. Another example would be pharmaceutical data analysis. So biostats and epi are two of our disciplines where we see a lot of our graduates go on to work for pharmaceutical health insurance firms, Apple and Google, because of the skill sets that students develop in those training areas. And in the United States, so this data is US specific, wasn't able to pull out all this data that would be specific to Mexico, so my apologies. But in the US, the average annual salary, according to the 2024 Bureau of Labor Statistics, is around $109,000 annually. Epidemiology. So what is it? The study of distribution of causes and prevention of disease and injury in human populations. Or as we affectionately call our epidemiologists, disease detectives. And they like to call themselves the founding discipline of public health. But really it is looking at the who, the what, the where, the when, the how of something that adversely affects your health. And that's where the disease detective piece comes from, right? They're trying to figure out what is the root cause of this. And they use various tools like occurrence of illness, injury and risk factors, estimating the effect of exposures on disease risk. And so they can take this skill set that they have in epidemiological methodology, and they can look at things like infectious disease, which is something that we are well known for here in highly emerging infectious diseases, but also can use it to look at cancer in populations, who's getting cancer, where are they getting cancer, things like that. But also mental health, or you could apply it to child health and looking at over time the health of children and some of the causes, the root causes, if they are suffering from adverse health outcomes. Example careers would be academic research epidemiologists, infection control, field epidemiologists. These would be the people that are out there figuring out a lot of times the source of the disease. So they were the ones that discovered that in the 2014 Ebola outbreak on the African continent, it was actually a child playing with a bat at the base of a tree in an area that had undergone deforestation. So the bats weren't up in the high levels of the trees anymore. They'd come down and were roosting in the base where a child could reach them. And so they can find that patient zero, right, of disease outbreaks. Health surveillance program administrators, so looking at the rate and causation of disease in populations and where it's going and who's getting it. Research epidemiologists and survey researchers. These folks have a U.S. Annual average salary of around $90,000 US dollars. Emergency preparedness. So what is this? It ensures that individuals, communities, and organizations are prepared and ready to respond for disasters, disease outbreaks, medical emergencies, and much, much more. Here, what we often see is they do a lot of drilling or mock disasters to practice and prepare for when disasters actually occur. And again, these can be man-made or nature-made disasters. COVID-19 was an example of a zoonotic disease that moved across the world. And here in the US, we had emergency preparedness plans in place. Unfortunately, there was not a choice to use them immediately. But other examples would be things like hurricanes and preparing people to safely either ride out or relocate during those. Earthquakes, fires, riots, sometimes they're human-made. We do a lot of consulting right now in Ukraine on helping people there prepare for when emergencies strike them and their communities. So there's many different ways. Example careers would be emergency management directors, emergency preparedness and business continuity coordinators. We're seeing a lot more industry and large companies hiring emergency preparedness individuals to help them protect their human and financial assets. Hospital preparedness coordinators in the US, every hospital has a emergency preparedness coordinator. Homeland security officers, corporate emergency preparedness directors, disaster research specialists, and emergency response consultants. These folks in the US average around a little over 88,000 US dollars in annual salary. Next, we're going to speak about environmental and occupational health. What is it? It's multi. There's a few different disciplines within here. It focuses on the relationships between people and their environments, promotes human health and well-being, and fosters healthy and safe communities. The occupational health side deals with all the aspects of health and safety in the workplace or the work site, and has a strong focus on primary prevention of hazards. Sometimes the most visible where we can see these is often if you go by construction sites, and you see signs up about where to go, and you see the workers or different helmets and things like that, or braces to keep them safe. That's a great example that is easy to see on the streets. But there's many more. And for example, healthcare worker safety. How do you keep healthcare workers safe when they're in environments where they may be dealing with highly infectious diseases, or they may have, things like keeping them safe from needle pricks or cuts as part of their operational procedures and things like that. And then finally, we're talking about working to decrease toxicological problems associated with environmental and occupational exposures. So that would be looking at making sure, for example, that, maybe back to our work site, if construction workers are going into an old building, old facility, and they don't know necessarily what's in there, taking additional precautions to make sure that they aren't exposed to something that may be detrimental to their health or hurt them. We do a great deal of work with agricultural workers in Nebraska. We're a very agricultural state. And so things like proper handling procedures for things like herbicide and pesticides, or we actually have people, students that work on safe bison handling for the U.S. Bureau of Indian Affairs, because turns out if you get gored by a buffalo, it's really bad for your health. And so that would, kind of plays into that occupational health side a little bit. Finally, career examples: environmental engineer, environmental health inspectors, environmental industrial hygienists, safety and wellness coordinators, climate change analysts, toxicologists, and water systems inspectors. Within the US, annual average salary for these folks in 2024 is just above 86,000 US dollars. Next, I'm going to speak about maternal and child health, which is a bit of a dated name because the reality is it is more whole family health, and not just mom and baby, but really the entire family unit, however that is made up. And it really extends through, especially through adolescent into early adulthood, for the children and for the families, mothers and fathers, and it extends for their well-being in that as well. So what is it? They plan and create programs and policies to address the health and well-being of mothers, children, adolescents, paternal, and family health. Some sample careers would be adolescent health coordinators, family health specialists, health educators for newborn screenings, maternal and child health policy analysts, program officers for HIV/AIDS Bureau, family planning managers, child nutrition coordinators. The 2024 annual average salary is just above $69,000 US. Health promotion. And for us here, health promotion and maternal and child health are in the same department. And that kind of makes sense when we talk about them because you can definitely see some overlap. Health promotion aims to enable populations and communities to achieve their optimal health. And they do that through social and behavioral change. So looking at how we as individuals behave in our environments and the choices we make and what influences us to make those choices and decisions, and those around us, right? And the society that we're in and how that impacts us in our health and the way we make decisions. Sometimes I think it sounds overly simple, but the reality is as individuals, we're very complex. And for me personally, what may motivate my decision-making, whether it's my gender, my race, my religious beliefs, my age, where I live, those all play a big factor in how we make decisions and what really influences us to either keep doing healthy things or to maybe change and make some healthier choices. And it's the creation of environments that are conducive to those healthy lifestyles. So, we can tell kids that they need to go outside and exercise, but if, there's no time in their day for them to go out and get exercise in, or if they're, they live in a place where maybe going out is not the safest, they don't have a safe place to go out and have an exercise, that has to be a consideration in that. And also design and test effective and sustainable prevention interventions, right? So, are we developing interventions to help people have healthy lifestyles that really work for them? What can work for one population may not work for another population for some of the reasons I just mentioned, right? The things that influence us in our decision making. Career examples would be things like community health educators, program health managers, community health assessors that really look at overall the health of an entire community and what's going on, disease intervention specialists. So maybe they're interested in helping people with cardiovascular disease or cancer, health and wellness coordinators. So really looking at like that prevention side, the healthy lifestyle, maternal and child health specialists, nutritionists, and project coordinators. Around specialty items. And similarly, the annual average salary for these folks in the US is just above $69,000 US. Next is health administration and policy. What is it? It is managing how healthcare and public health services are financed, organized, and delivered. It's helping healthcare providers find more cost-effective means for completing their work. It's translating research into practice and policy to ensure adequate access to quality healthcare services for all peoples. So this really is very much on the healthcare administration side, the business side of healthcare. It's running the hospitals or the clinics or the healthcare systems, making sure that people can get paid, making sure that the resources are getting to where they need to go. So a lot of supply chain management. It is, the getting the human resource side of getting the right people in the right positions and making sure that they have the capacity to carry out the tasks that they need to do. It is looking at ways to reduce the cost of healthcare for individuals and to keep the health systems soluble. Then the policy side, and this is where I kind of nerd out a little bit because I enjoy the policy side, really health policy, whether it's very local, it can be the policies that are made up in your towns or your local communities, things like maybe making sure that you have crosswalks for people to cross the street safely, or putting in new parks, to larger, maybe state level policies where looking at care and things that you need in those communities, or whether it's national health policies. So some of the big policies, like in the US, we have many years what was called the Affordable Care Act, which really looked at making sure that there was options for healthcare plans for people, even if they weren't working for employers that offered them, or looking at legislating that that physicians and clinical practices also look at what's going on in their communities, so that they can really address those health issues and do what they can to help people not get sick and end up there, and finally, or make sure that there's mental health support. For examples would be administrative services managers, behavioral health directors, community service managers, hospital chief executive officers, human resource managers, outpatient care supervisors, pharmaceutical health insurance specialists, administrators for wellness programs, and the annual average salary in the U.S. in 2024, according to Bureau of Labor Statistics, is a little over $134,000. Okay, I'm going to take a quick drink here. I'm going to lose my voice. Now I'm going to speak to you about us here, the University of Nebraska Medical Center, our College of Public Health. That picture there, that's looking up at our building at night. It's one of my favorite pictures, just because it got taken at night and it actually turned out, which, let me tell you, doesn't happen to me very often. We are located in Omaha, Nebraska. You can see on that map there, it's real tiny, right there, kind of in the middle of the country. We are the 42nd largest city in the United States, so we are by no means the largest. The metropolitan area is home to over 900,000 people. That kind of extends across multiple smaller cities that are connected with Omaha. We are the home of headquarters of companies like Berkshire Hathaway, if you've ever heard, Mutual of Omaha, Union Pacific Railroad, and a number of other large companies. And also we have some of the largest architectural and engineering firms here. Also, from the cultural institutions around Omaha, we have the Henry Dorley Zoo, which is always ranked in either #1 or #2 in the U.S. An aquarium. We have what's called the Old Market, which is a lovely area, Durham Museum, Lauretzen Gardens, the Latino Center of the Midlands, El Museo Latino, and we also annually host the College World Series. So once a year in June, it is full of baseball fans here in Omaha, Nebraska. This is a picture looking at part of our campus. This building right here is called the Global Center for Interprofessional Education. And this entire building is dedicated to simulated training, meaning there's actual live patients in this building, but there are all kinds of training facilities where students can go through simulations, whether it's with simulation patients or operating rooms, exam rooms. There's even what looks to be like a small house on one of the floors. So students, like in areas of occupational health or occupational therapy, maybe or physical therapy, could work with a mock patient through what it would be to move around their house, maybe after a severe bodily injury that they're recovering from. There's the 4th floor is entirely, we train the U.S. Public Health Service Corps, which is a branch of our military, but they're the healthcare workers. We train them all here in Nebraska on managing highly infectious diseases. So that entire fourth floor is dedicated to simulation training for them. So UNMC, by the numbers, we are a comprehensive health science center with a clinical partner in Nebraska medicine. We have over 4,400 students in around 90 different programs here, nearly 50 different academic departments. We do almost 900 million in an annual operating budget and over 200 million in annual research grants. And there's over 6,000 people that work here. We are comprised of 6 colleges, 2 degree granting institutions, and a graduate studies program. We have a College of Allied Health Professions, College of Dentistry, College of Medicine, College of Nursing, College of Pharmacy, and then us, College of Public Health. We have the Epley Institute for Research in Cancer and Allied Health Diseases. We have the Monroe-Meyer Institute that really looks at neurodiversity and development issues, especially in children, but not exclusively. And then, of course, we have graduate studies where many of our students train in their research degrees. This is another angle on the UNMC campus. This is looking more at some of our larger research facilities. So now I'm going to talk to you a little bit about the College of Public Health. From the faculty, we're over 84 dedicated faculty in the College of Public Health, over 76% externally funded, and over 30% published and peer-reviewed annually. For students, we don't have any undergrads. So all our students are graduate students, meaning they have a bachelor's degree by the time they come to us. We have 442 graduate students. About 54% or just a little bit over half of those are full-time enrolled students. So we have a good number of students that are actually also working and going to school. And some of them are already trained professionals in dentistry or medicine or law, and they're coming back and adding greater public health training to their repertoire. 70%, about right around there, of our students are female. About 30% of them identify as male. About 24%, actually that's up just a little bit, of our students are international, so coming to us from another country. And we have a 100% pass rate that we have continued on our national exams among our students. And these are all pictures of our students and faculty in different places in classrooms. And this down here is example of some of the stuff that our international office does. This week is actually International Student Week, International Education Week. And so we've had a lot of festivities. This is the Holi celebration that a number of our Indian students put on each year. Now I'm going to speak to you about some of our programs. As I mentioned, they are all graduate level, meaning somebody has completed a bachelor's degree or more prior to entering these degree programs. We start with our certificate programs. These are designed specifically for working professionals seeking knowledge and tools to enhance their public health practice. And so these are shorter, 12 to 18 credit hours. They can be done online or on campus. A couple of these are also eligible for students to come globally and study on campus for a year. Some of them are F1 eligible, and they would be this public health, which is the generalist, and that is the core of the Master of Public Health program. And I'll talk about that. That's a 15 credit hour program. So students can come for 1 year on visa to do just that program. That one is as well as the applied biostatistics. We also do emergency preparedness. This one's 18 credit hours. And it is very focused on the core training areas of emergency preparedness and readiness. We have one in occupational safety and health. And then, yes, this maternal and child health is too. Then we have the Master of Public Health, and this is our most populous degree in the College of Public Health, and probably one of the most popular and sought degrees for those training in public health. This is a 42 credit hour program. Full-time students do it in 2 years. It can be done online or on campus. For international students, we've had some of them started online, and then in year 1 and then year 2 come and spend a year here training. Or they have flipped that and done year 1 here and then gone home and finished their training of year 2 as well. And some that just do 2 years here with us, or do online from their home country. So there's a number of options there. It can be worked on kind of based on what fits your life and your needs. The students concentrate in one of these 7 areas of biostatistics, emergency preparedness, environmental occupational, epidemiology, health promotion, maternal and child health, and public health administration and policy. And we're also working on adding some further training in the area of public health informatics as well. Health, we have a Master of Health Administration. This is prepares professionals for leadership positions in healthcare organizations. So this would be back to that business side of healthcare. This teaches in the areas of leadership, communication, relationship management, professionalism, knowledge of healthcare environment, and business and analytical skills. This degree program is only offered online, so we don't take F1 students in country for this one, but students can train from anywhere in the world on this one. We do a Master of Science in Biostatistics. This is a 36 credit hour program that can be done entirely online or entirely on campus. It teaches in the areas of data management and computing, statistical reasoning, scientific logic, data analysis, and data interpretation. And this is one of our newer but faster growing degree programs. There's a big push in the US for data science and training and biostatistics. The Doctorate of Public Health is our professional doctorate degree. So there's 2 general types of doctorates. You have professional doctorates and you have academic doctorates. Professional doctorates, other than the Doctor of Public Health, you may be familiar with MDs or a PharmD or a dentist, a DDS, or a lawyer, a JD. Those are all professional doctorates because they're training you for practice. And that's what this one is doing. This is really to train those professionals that are out there in major leadership positions. A lot of our students in this work for the World Health Organization or the CDC, UNICEF, leaders in their state level health departments. And it has concentrations in epidemiology, emergency preparedness, leadership, and advocacy. This training is 54 credits long. And it is done entirely online because these people are still working in their respective industries while they're finishing their degrees. It teaches in leadership, management and governance, data analysis, policy and programs, education, workforce development, designed for students that are full-time working, as I mentioned. And they do a practicum, develop a digital portfolio, and complete a dissertation, a practice-based dissertation. So in difference to PhDs, which I'll speak about here in a little bit, and from our wonderful PhD student Carlos is here. He's in a research doctorate, and those are more theory-based, where this is looking at solving problems that are occurring in those individuals' jobs. When it comes to PhD programs or our academic doctorates, these provide students training in becoming a skilled research scientist. Will I have impact on health populations, really around thinking critically, around public health programs. PhD programs are 90 credit hours past a bachelor's degree. And so if somebody's done a master's degree, then those credits will count towards that 90. A good portion of those will be brought in. If they have not completed a bachelor's degree and they're admitted into a PhD, then it's about 90 credit hours. So it's a longer degree program. We offer PhDs in biostatistics, environmental and occupational health, toxicology, epidemiology, health promotion and disease prevention research, and health services and policy. So some admission considerations to make. I'm not going to go through all the different programs and all their different admissions requirements, but here are some basics that are really important to know. For all our current degrees, a bachelor's degree is required. It does not have to be a US bachelor's, it can be a bachelor's level equivalent. We have a lot of international students. So any bachelor's level equivalent in any country will suffice. We don't really care that much about your major. And I know that's a little bit surprising because some programs, different disciplines, they are very specific about what major you're going to have if in your undergraduate, your bachelor's degree training, what was your focus. Any is fine. But you should really have at least a semester of a biology course, a semester of a chemistry course, and a semester of a statistics course. Chemistry is maybe not as important for some areas, but if you're going to go into environmental or occupational health, maybe also epidemiology, it can come in real important, but definitely a biology and a statistics class. And then anyone who's trained outside the US has to do English proficiency, and we accept the TOEFL in 550 score paper, 213 computer, 80 internet. Most folks do internet these days. We do accept IELTS or IELTS at a 6.5, and we just added we accept Duolingo in a score of 120. Okay. I am going to rest my voice now, and we would like to open it up for any questions.
Okay, well, questions, they haven't come yet, but I don't know if we can hear from Carlos, perhaps his perspective as an international Mexican student at your university, Jessica. What do you think?
I think that would be fantastic.
Okay, Carlos.
Okay. Could I do that in Spanish?
Yeah, sure.
Okay. Lo quiero hacer en español porque puede haber como que algunas inquietudes. A veces el idioma puede a veces ser como una barrera. Hola, me presento, soy Carlos Martínez, yo soy de México, yo soy originario del estado de Morelos. Nací en Morelos, estudié como una carrera técnica de bachillerato, yo soy técnico laboratorista. Después de eso entré a la universidad, hice medicina en la Universidad Autónoma del Estado de Morelos, soy médico de formación. Posterior hice una maestría en salud pública y especialidad en epidemiología. Ya con ese posgrado ya empecé a trabajar en México. Fui clínica, pero nunca dejé como de a un lado la investigación. O sea, seguí trabajando con el Instituto Nacional de Salud Pública. Soy formado en el Instituto de Salud Pública. La sede principal está en Morelos. Siempre tuve colaboraciones con ellos. Trabajé para la Secretaría de Salud, para un hospital público de segundo nivel. Y llegué a ser jefe de servicio. Trabajé como médico atendiendo pacientes, pero como que esas ganas de seguir aprendiendo y de querer como saber más, y más por el impacto como de la pandemia, sí me hizo como que buscar opciones ya aquí en el extranjero. Tenía la intención de aplicar desde como pre-COVID, pero por algunas circunstancias no fue posible. Entonces, con COVID, pues obviamente a los médicos y pues todas las personas como que brindamos atención, pues también los servicios educativos que son importantes, todos como los servicios prioritarios, pues fuimos pues muy requeridos, ¿no? Entonces también como que no tuve la oportunidad de aplicar, pero ya posterior a COVID, todas estas enseñanzas como que nos dejó, sí, y estas ganas como de seguir aprendiendo y pues de ver opciones de posgrado, fue que pues me puse a investigar, vi varias opciones, y fue que pues sí me quise venir a estudiar acá a Nebraska. La verdad, sí felicito a ustedes, a los programas de Education USA, porque sí conozco, bueno, yo no conozco las dos sedes de donde son ustedes, que son Mérida y Guadalajara, pero la sede que tienen en la Ciudad de México sí la conozco. Realmente ustedes apoyan bastante. Sé que puede haber muchas como inquietudes al momento de querer aplicar o incluso de saber cómo cumplir con los requerimientos que piden. Y yo creo que si un consejo les puedo dar a los que están escuchando, pues es que se acerquen a ustedes. Como pues lo mencionaron a un principio, es de que pues los servicios son gratuitos. Eso es muy bueno. Eh, pues yo que más quisiera que pues si fuera como que se vinieran a donde yo estoy, pero pues busquen las opciones, busquen los programas. Realmente el Colegio de Salud Pública donde estoy es muy bueno. Son programas muy completos. Eh, Volviendo como a la parte de que antes de venir para acá. Un consejo que se acerquen a ustedes, que empiezan a ver como los programas, si quieren aplicar ya como que en para ya el siguiente año, que serían ya para pues el semestre de verano o de otoño, por lo regular las fechas límites empiezan ya a cortar a partir de diciembre, entonces ya sería así como que poquito tiempo, pero hay muchas universidades en donde, pues incluso el Centro Médico de Nebraska, donde hay diferentes programas en donde tienen un deadline, una fecha límite un poquito más amplia. Entonces, busquen los programas, vean los requerimientos, acérquense con Education USA, incluso por las redes sociales, también funcionan. Ya una vez que completan las aplicaciones, como lo comentó mi coordinadora, vieron los requerimientos, vieron todos los programas, realmente son muy buenas opciones. Lo que ella mencionó de que no es como prioritario que tengan, lo que ella menciona como de un minor o un minor, son como las áreas de especialización o requisitos que piden previos a aplicar el programa. Por ejemplo, yo en el programa en el que estoy, que es Health Promotion, yo soy médico, tengo una compañera que también es médico, que viene de Asia. Ella se formó como médico en Asia, ella es pediatra, y ella posterior hizo una maestría en bioestadística en UCLA y regresó a trabajar a su país y después pues completó su formación, o está completando su formación aquí conmigo. Eh, yo soy médico, epidemiólogo, también trabajaba en hospital, atendiendo pacientes y aquí obviamente pues vine a aprender sobre salud pública y prevención de enfermedades. Pero también tengo compañeros que son con formación, por ejemplo, en psicología, que se enfocan o van alineando sus programas o sus líneas de investigación hacia programas preventivos o de salud pública y pueden ser buenos candidatos para estos programas. Les recomiendo pues, el campus, ¿no? UNC de verdad está muy padre. Y pues, no sé si tuvieran alguna pregunta, eh, ya sea para mi coordinadora o para mí, con mucho gusto las podemos atender.
Ok, tenemos una pregunta de Isabela. Isabela, creo que puedes abrir tu micrófono, entonces adelante. Oh, no le deja. Ok, a ver, dame un minuto entonces. Ay, ay, ay.
Tenemos otra pregunta de Luis Miguel.
Sí, quizás para Carlos. Carlos, ¿cómo le has hecho con los ensayos en inglés, eh, con las presentaciones en inglés y cuál fue tu grado. Estaba exponiendo tu coordinadora que lo mínimo es 6.5 en IELTS, yo alcancé 6 y también tengo el First Certificate in English de Cambridge, pero creo que no es suficiente. No sé cómo has lidiado tú con el inglés, con las entregas de los ensayos principalmente, con el avance de la tesis y cosas de esas que es un inglés muy formal y creo que muy alto, ¿no? Para tener un 6 como yo, un First Certificate in English, creo que no sería aceptado y además, sobre todo, el cómo entregar todos estos documentos, todos estos papers, a los académicos, Carlos.
Bueno, respecto a nivel de inglés, cuando yo quise aplicar en una primera vez, yo me voy a basar a TOEFL. TOEFL piden 80. La primera vez que yo quise aplicar tenía 69. Obviamente no era un nivel adecuado, eso fue un año anterior. Entonces, justo antes, como por mayo del año pasado, volví a hacer el TOEFL y ya tenía 75. Y en, justo ya me puse a estudiar. Hay muchos cursos que se enfocan más en mejorar el nivel del TOEFL. Eso es muy bueno, pero sirve como para responder las preguntas del TOEFL. Pero si todavía tienes como problemas para entender las conversaciones y todo eso, pues sí son totalmente tomar clases primero de inglés. Ya mejoras el inglés y ya después tomas el TOEFL. Pero sí lo puedes mejorar. Hay muchas clases o cursos intensivos. Eso funciona bastante bien. Este, sí logré subir el puntaje, no solamente apliqué aquí en Nebraska, apliqué a otras universidades, afortunadamente fui aceptado en otras universidades, pero valoré todo, desde cuáles son mis objetivos, las características que tiene la escuela, las oportunidades. Este es un centro médico, para mí se adapta bastante bien, y también ver la seguridad, el costo de vida y obviamente si te dan beca o no y las oportunidades que hay. Los ensayos, yo creo que los puedes, si te complicas hacerlos en inglés, hazlos primero en español, ya después los puedes traducir. Y si hay algún requisito como que como que, digamos, se te esté dificultando, por ejemplo, una revalidación o las cartas que mandas a los servicios de web para revalidar los títulos y eso, si hay algún tema ahí, te pueden ayudar bastante bien justo los coordinadores que tenemos, así como Jessica. Jessica ayuda bastante, o si, por ejemplo, en UMC también hay alguien específico en el Colegio de Salud Pública, en el Colegio de Farmacia, en el Colegio de Medicina. No sé si contesté bien tu pregunta, yo creo que di bastante información. No sé si hay alguna otra pregunta.
Tenemos la de Isabela, no sé si ya puedes desbloquear tu micrófono, Isabela. Ok, pero si no, Carlos, muchísimas gracias por esa respuesta. Creo que se alinea muy bien a lo que Education USA ayuda y cómo ayuda a los estudiantes, ¿no? En tu caso, tú mencionaste, tuviste varias aceptaciones, ¿no? Pero como que hasta cierto punto ese es el mayor conflicto que nos gustaría que nuestros estudiantes tuvieran, ¿no? O sea, tener muchas opciones y decidir ahora sí con quién me voy, ¿no? Pero creo que tú pusiste muy bien este punto de decir evalué muchas cosas dentro de las aceptaciones que ya tenía, los costos de vivir y las oportunidades que tenías dentro de la universidad también, ¿no? Entonces, gracias por también ayudarnos a ser más objetivos en nuestro trabajo, ¿no?
Sí, digo, lo más padre es, yo creo que recibí las cartas de estación. Todavía me acuerdo y siento padre, siento bonito. Eh, Donde pues ya te explican, ¿no? Te aceptan qué te ofrecen, eh, y ya es cuando puedes empezar obviamente eso es como una preselección de los programas a los que quieres aspirar. Yo siempre digo, pues apúntale a una estrella y mínimo, pues no le vas a tirar a esa, pero pues igual y le puedes atinar a otra. Entonces, pues en mi caso sí fueron 6 universidades perdón, 7 universidades y 10 programas en total los que he aceptado. Y ya de ahí no es así como que, no es irse como que quién me ofrece más o quién da más oportunidades, no, es a lo que yo creo que ver tus objetivos y valorar muchas cosas, ¿no? Los programas, los profesores, los advisors, muchas veces es ver primero si ese advisor tiene espacio en su laboratorio o en su área de trabajo para aceptar estudiantes. Y ya que se siente padre poder después diferenciar entre las opciones que se ofrecen. Y yo escogí pues, Nebraska, es una ciudad tranquila, el costo de vida no es tan alto, tiene buen nivel de desarrollo, es un centro médico. La ciudad no la conocía, de verdad no la conocía, es muy padre, es tranquila, no es una ciudad de tumulto, no es una ciudad de rascacielos, es una ciudad tranquila. No es la capital del estado, la capital es Lincoln, está como a hora y media de acá de Omaha, pero es una ciudad que me gusta. O sea, aquí llevo 3 meses, pero está bastante padre. Nunca había vivido en un lugar con frío y ahorita todavía no me acostumbro a cómo manejar los grados. Ahorita estamos a 5 grados. Muy probablemente el próximo jueves caiga nieve. No, es algo también con lo que decías del choque cultural, de cómo te vas acostumbrando a todas estas cosas, pero aquí estamos. Y cualquier cosa que se acerquen con ustedes, tú tienes ya mis datos y digo, podríamos, si los pudiera ayudar en algo, colaborar. Con muchísimo gusto.
Perfecto. Bueno, David, no sé si
Creo-
puedes desbloquear tu micrófono.
Sí, sí se
Ok.
me escucha ahí.
Sí,
Sí, te escuchamos.
Ah, sí, pues yo tengo varias preguntas. Pues una de las primeras es que no soy mexicano, pues, pero estoy residiendo aquí en Guadalajara. Estoy estudiando una maestría en lo que es esto de ciencias de la salud en el trabajo, todo lo que es relacionado a pues seguridad y salud ocupacional, principalmente. Entonces, no sé, y bueno, y de parte de formación, pues soy psicólogo laboral. Eso es curioso porque pues de donde provengo, que es de Ecuador, me formé directamente como psicólogo laboral, no me formé como pues, como casi en toda la región es, que primero te formas como un psicólogo general y pues luego como que haces la especialidad, sino que no sé, cuestión de la universidad que fue, pero pues ya, o sea, ya nos formaba desde el inicio así, tal cual. Entonces, o sea, mi pregunta es eh, si, pues sí es más complicado, ya que pues yo de hecho no, n- n- bueno, actualmente pertenezco al sistema de educación de aquí en México, pero pues mi base de, de bachelor's degree no es el que, o sea, no es de aquí. O sea, esa sería una de mis preguntas. Y pues, y la otra es en cuanto a la parte de recursos en cuanto a los costos de la movilidad. Eso.
ok. Tal vez entonces esta pregunta es más enfocada para Jessica. Jessica, so we have a question regarding David. He's from Ecuador, but he's living in Mexico. His undergraduate degree, he got it in Ecuador, but now he's working and studying a master's degree here in Mexico. So I guess the main question will be, could he apply for, in this case, University of Nebraska, and what are the opportunities for him to get like some kind of like financial aid?
have to come off mute. All right, yes, good question. So yes, he could absolutely apply to study at the University of Nebraska Medical Center. It depends a little bit on his area of interest. His training would not hinder him from applying honestly to any of our degree programs. We would recommend that he meet with or correspond with the admissions office a little bit so they could do some analysis and let him know kind of where he stands. I will share this because I think this is sometimes a bit of a mystery, at least it is to our US students. The admissions office doesn't make the admissions decision. They're there to help the student develop the best package of an application to submit to the committee. So when you reach out to the admissions office, this is a good place to ask them. They can look at things like what you're interested in doing, what you've taken already, what kind of degrees do you have and coursework do you have, and really give you a good assessment of your readiness for if you wanted to do another master's program, you want to do a certificate program, maybe if you wanted to go on to a doctorate program, can help kind of coach you individually as to where you stand, and then maybe what your next steps would be in that. Now, yes, do we have financial support for international students? We do. At the master's level, it is less common to get a full scholarship or a full ride. There's more often it's partial. So you maybe get a part of your degree covered, and have to fund the rest. Sometimes you get multiple scholarships, and you put those together at the master's level. At the PhD level for us here at UNMC, we do offer full assistantships. So it covers all your tuition, about 80% of your fees, not all of them, there's a couple left, about maybe between 100 and 500, depending on your semester of fees that you'd have to pay. But then you also get paid as a stipend. And right now that's right around 30,000 annually, but you get paid each month as a PhD student, a stipend, and you work with a faculty researcher for 20 hours a week. So you're studying, you're working with your faculty mentor, and that's what's funded at the PhD level. For us, those are a little bit different. I will encourage you, that is not the same across all institutions. So really ask those questions and investigate what those assistantships are. Because we have peers that maybe they'll pay half your tuition and you get a stipend or, and other things, but they won't, they cover different things. So ours covers all tuition, almost all the fees, and then pays a stipend. Does that answer most of that question?
I guess it does. Thank
Okay.
you very much, Jessica. Isabella, can you unmute yourself?
Yes.
Yes. Okay.
Do you hear me? So, I want to ask, like, actually, I have 16. I'm in high school. I think I love a little. So my question is, I read healthy policy management, and when I was a kid, I always wanted to study medicine, but right now I don't like the blood and that stuff, and I'm interested in healthy policy management. So my question is that when I studied health administration and policy, I saw like a lot of things of blood and that kind of things. Because I right now I want to study like law, and I'm interested in law, so that kind of be an option because I don't want to be close of only law, only medicine. So I think this could be a good opportunity to mix that two things that I like. So that's my question.
Great question, Isabella. You're a woman after my own heart, because I
Thank
was the
you.
exact same way. Very interested in health and improving health in people and hospital administration, and that was all I didn't mind the blood. I just didn't really want to deal with it on a daily basis. And I kind of wanted to work with more people instead of just one-on-one. So, so in preparing for that career trajectory, I will give this advice. At your bachelor's level training, there are a few degrees that will get you well positioned. Business training, any kind of undergraduate business degrees would be good. Political science as well is also pretty good, especially if you kind of lean a bit more towards the policy side. But you can study kind of depending on your institution. At the undergraduate level, you could study both. And then if you have the option to do, kind of depends on your institution. I know here in the US, our undergrads could do like a business major, but they could do a pre-law set of courses that they would do along with that. I'm going to ask Ana and Jorge, is that something that's common in Mexican undergraduate institutions? Maybe no, we don't. Okay. That's what I'd recommend to kind of well-round yourself. Because the reality is of a career, you're probably your career is going to be a little bit more like this instead of like this, right? And it sounds like you have multiple interests, so you can kind of cover your bases with some training like that. So doing some business, maybe some poli-sci, maybe having that pre-law track, so that you're preparing for yourself for law school, because a lot of people that go into healthcare administration come in with law degrees. In the United States, across the board, lawyers don't make much money. Healthcare lawyers and health policy lawyers, on the hand, make a lot of money because they're in very high demand. So those are good skill sets that are very translatable to have. And so you could take those, and then if you are decided halfway through, you know what, I want to do corporate law, you're already positioned for that. Or if you're like, I want to go environmental law, you would already be positioning yourself in some ways to be able to work in those spaces. So I encourage at the bachelor's level to kind of maybe mix and pair a little bit of there. So you're making yourself as developed as possible for that kind of next step, because you're going to learn a lot of things about yourself in the undergrad career. You want to be as nimble as you can, but still allow yourself the space to explore some of those interests. Does that answer your question?
Yes, thank you. It's because right now I'm in the point that I'm finished third semester, sorry. And I'm like in that point that I don't know what to study. I'm like anxious. I don't know what to do with my life. And I want it to study in USA. I'm very interested. So yes, thank you. So the career that you recommend me is like a law medicine?
I would go maybe more law business or political science law. And you maybe don't have to major in all of those, but you can be also maybe pick one major focus area and add some of that other on the side as part of your electives or part of that study as an undergrad. But I would lean more towards poli-sci or business, and then adding some law on top of that.
Okay, thank you.
Yes.
Okay, we have one question here in the chat box, and then we go with Ayari. Is that, I mean, we are over 15 minutes. So Jessica, thank you very much for this.
Sure.
So the question here from the chat box is, what are the chances or the opportunities to work in the United States once I finish my program at a university in the States?
Yeah. So they're pretty good, especially if you select, doesn't have to pick one of our STEM ones, but some of our STEM-based ones, so biostatistics, epidemiology, environmental, occupational, for us are all considered STEM degree for visa reasons. And what you can do with those, they have a little bit more extended OPT training period where you can actually, which is occupational training after you do your graduate degree, so you can get a job. and work. And so we see a number of our international students who want to stay in the US and work. That is a great way because you don't have to, through that process, then we see our students start to move into maybe more of a naturalization process. But if they're working for an organization, that organization will help them in sponsoring that. So there's really good opportunities for those. Most, I don't want to say all, but almost all of our students who apply for OPT get OPT positions. One thing about Nebraska, we have a very, very low unemployment rate. So employers are looking for students who want to come in and bring their skill set in. And with OPT, that's kind of your chance to do some practical training, get your foot in the door on the working side. And then for our international students, we do have an office here that helps our students who want to apply for OPT, and then we have dedicated career services in our college that help students apply for those positions as well.
Okay, well, thank you very much. I think Ayari, do you have a last question, Ayari? Okay, I don't think she does.
Yes,
Oh, yeah.
sorry. It's because that was my question. Like, if I study in USA or in another country, like I need to live there, or can I live here, or like what are the opportunities that I have? Like, it's obligatory to sorry, like to live there, or what it is.
Good question. So again, it depends on the programs and the institutions you're applying to. For us, and the ones that you've seen me present today, not the PhDs, but almost all the other programs, let me think off the top of my head, all the other programs you can do as an online student from anywhere. So for example, we actually have online students in the Ukraine right now. We have online, they're Ukrainian, they're there. We have online students on the African continent. We have an online student, some in Brazil. And so they can study from where they're at. As long as you have access to internet, like that's kind of the main thing. And for our online programs, we have no required live sessions. We have some optional, so you can join live and ask questions and things like that, but you can do most of them you can decide in your week where you want to work on your studies. We've had students who maybe started online and did their first year online and then came to the US for the second year, if that was an area of interest to them. And there's flexibility, you don't have to decide that right away, or vice versa. Or you can do the entire thing from your home country. Personally, I think that's a very cost-effective way to do it, if you weren't necessarily interested in coming to the US.
Okay, thank you.
You're welcome. Good question.
Thank you so much, Jessica. There was another question about postdoctorate occupational health, and I already pasted the link to the official website of UNMC. So I think they can also find the information there.
Yes.
And well, we really want to appreciate your collaboration today to Jessica and Carlos. It was very interesting. And as I mentioned at the beginning of the presentation, one of the advantages of studying in the US is the flexibility of the programs. So because your university, the admission requirements are very flexible because you don't have to be a doctor to study a graduate degree at UNMC. So take that into consideration because that might be one of your options, guys. So thank you so much for everything, and thank you also for all the attendees that we had today, and we hope this information was very useful for you. Yes.
Thank you. Truly my pleasure. Thank you all. It was wonderful to meet with you today.
Thank you so much, Jessica and Carlos.
Oh, thank you. Muchas
have a
gracias a
nice
todos los
day.
que atendieron la reunión. Gracias.
Gracias.
Gracias a todos.
Thank
Gracias.
you.
Thank you, everyone.